So this second tutorial is, let me just move this out of the way. Sorry, chat's getting in the way here. This second tutorial is cardiac anatomy. Let me just reinforce here at the beginning of the tutorial that tutorials are meant to do precisely that, to reinforce things. So hopefully you'll have had a chance to see lectures so far, including the cardiac anatomy lecture that was posted this morning. Well, this is meant to reinforce things and to highlight some of the more important elements. And what I aim to do here is, perhaps the aims are a little bit more modest than the last tutorial. Firstly, I hope to help you identify specific anatomical structures simply using standard two-dimensional echocardiographic images. So that is to say, in the anatomy lecture, I spent a lot of time looking at illustrations, and there were certain, images of anatomical specimens that we used to highlight different anatomical features. But here we'll be really focusing in on how those features are demonstrated using echocardiography. And then secondly, relate why multiple views are used to identify cardiac anatomy with echocardiography. So hopefully this tutorial will help you to appreciate those two. Well, let me start just by saying that the heart is a 3D structure, of course, like all the other organs of our body. And as such, using two-dimensional echocardiography, there are obviously going to be some limitations. 2D echocardiography remains the modality used most often to image anatomy. It's still very widely used, and I anticipate that it will continue to be the case because despite the limitations, there are a lot of very good aspects about it as well. What I want to help you to appreciate here is, in the last tutorial we spoke about imaging planes. What I want you to remember here is with echocardiography there are some limitations. We're slicing through the heart, acquiring 2D images. Moreover, there are certain anatomical structures that protect the heart and mean that we've got to look at it in ways that perhaps we wouldn't if we weren't using sound waves. So we've got to compensate for the fact that the sternum is in the way, that the ribs are in the way, so we've got to direct the probe and ultrasound beam appropriately. I want to, because this is just the principles of cardiac sonography 1, I want you to appreciate that we're sort of starting from the outset, starting from the beginning, but that even with relatively few images, and on this screen we've got 4 images, parasternal images here, and then on the next screen some apical images, 4 apical images, and then some other images taken from the subcostal view, the top 2, and the suprasternal view, the bottom 2. We can see a lot of anatomy. And so let's go through each of them slowly. One of the aims of the tutorial here was to recognize specific structures, and here are some of the features of the cardiac chambers I want you to appreciate. You want to recognize structures, in this particular case the chambers using those images. So let's go back to the top there. Well, let's go through things in a kind of a systematic way, as though we were had in the back of our mind the anatomy lecture where we went through things again systematically, starting on the right side of the heart. So let's see if we can, starting on the right side of the heart, from any of these images, appreciate the right atrium. Well, I'm sure a couple of you are jumping up and down and saying, yes, yes, I can see the right atrium there. Certainly can. So here's the right atrial chamber here. On that list, and you can refer to that when you review this, one of the structures I wanted you to appreciate as well was the interatrial septum. So from this particular view, which is the parasternal short axis view, at the level of the valves, you can appreciate the interatrial septum. So right atrium, interatrial septum, left atrium here. Just going to go to the next slide. Sorry. Here's the next slide. We're still thinking about the right atrium. Here's the right atrium in our apical four-chamber view. Here's the interatrial septum as well. Can we see the right atrium again? We can certainly see it there. Also, interatrial septum. The inferior margin of the right atrium, as you'll remember from the anatomy lecture and from the list that you can refer to in a moment, the coronary sinus is an important structure within the right atrium that you can often see. And if you tilt a probe posteriorly, you'll certainly oftentimes see the coronary sinus at the back of the left atrium and emptying into the right atrium there. And then, of course, we can see the features of the right atrium from the subcostal view as well. Sorry, I'm just having a moment here with the technology. So, right atrium there, interatrial septum. This is a really key view to be looking at the interatrial septum, because as you'll remember, when you're imaging with 2D, the best images are acquired when you're acquiring or imaging structures that are at a perpendicular incidence to the ultrasound beam. So the top of the sector here, the top of the sector always indicates where the ultrasound beam is being transmitted from, so that the probe's been held up here. Ultrasound beams are being directed down this way, and so the interatrial septum is almost perpendicular incidence. So that's one of the reasons why it's really well seen there. So there's some of the features of the right atrium that I want you to notice for the moment. There are other features that we'll need to get used to as well, but that's what I'll get you just to appreciate just for now. Let's go have a look here again, the right ventricle. So, okay, let's have a look at the chamber, free wall, moderator band, and right ventricular outflow tract. So, let's just get our little highlighter. Whoops, sorry. Let's get our highlighter here. So, parasternal long axis view, the very first one. At the top here, the most anterior of this of the chambers is the right ventricular chamber. We go over here to the next one. You can see part of the right ventricle as well. We can see what's called the right ventricular outflow tract. Curved structure here, and it can be appreciated, the right ventricular outflow tract here too. This bottom image, which isn't as clear as perhaps I'd like it to be, is the right ventricular chamber is the more oval or crescent looking chamber here. While the right ventricle has what's oftentimes termed a free wall, and the free wall of the right ventricle, is seen there, and you can see part of it in that top image too. What we can't see on that particular image is the moderator band, but hopefully we have a look at one of the other ones here. You'll notice that there's a structure sort of 2/3 of the way towards the apex. It goes across here, and it's the moderator band, and that's the passage of important electrical fibers within it. The right ventricular outflow tract I pointed out to you earlier as well. So there are a number of anatomical features of the right ventricle that you can see from different planes, and subcostal views help us to see the right ventricle also. Is the right ventricle here, the right ventricular free wall. If you've got a really nice view, you can see the moderator band there too. The left atrium, we might start with this particular view, and we'll work our way backwards this time. Here's the left atrium here. Obviously we can see the interatrial septum. We'll go back one slide and have a look at the left atrium from this view. Here's the left atrium here. What you can appreciate here is one of the pulmonary veins. So the right upper pulmonary vein feeds into the left atrium. And down on the bottom right hand screen, part of the screen, what you can also see is another feature of the left atrium. You can see the left atrial appendage. So I hope to be highlighting the fact that what we can see from these standard views is a lot of anatomy. Let me just go up here as well. So in the very first image we've got, it's the left atrium here. You can see, as I said earlier, the interatrial septum, the left atrium there. We wanted to see things about the left ventricle. Okay, so we want to see the chamber, left ventricular chamber. We want to see the interventricular septum. We want to see the posterior wall of the left ventricle too. Of course, we can see the left ventricle beautifully here, the round left ventricle, and that's indicative of a very normal looking left ventricle. We can see papillary muscles, the lateral and medial papillary muscles in that particular view. Here we see the left ventricle again. We see the septum, the apex, the lateral wall. This one's focused up here, and what I hope to do, help you to appreciate in this particular one here, is, as was highlighted in the lecture on anatomy, is there are basal, mid, and apical portions. So it's helpful to divide the left ventricle up, oftentimes, because those territories, or those regions rather, correspond to different territories that are supplied by coronary arteries. So Kenny was talking earlier about myocardial infarction. Well, one of the obviously important effects of a myocardial infarction is blood supply is limited to the heart. That's obviously can be appreciated on the ECG. What that means mechanically is that certain parts of the heart aren't going to be working as they could. So, for example, if there was a lesion in the left anterior descending coronary artery, which typically supplies the apex of the heart, and the apex of the heart is formed by the left ventricle. You may well see, you may well see impaired motion in this particular part of the heart. And so it's important to be able to describe that, which is where you would start using terms such as apical. In this particular slide, down the bottom here that I'm highlighting, we see the left ventricle again. Because it's a two-chamber view, we're looking at different walls. I don't want you to appreciate them all just yet. I certainly do want you to remember that there's the chamber and the walls. I showed you earlier on pap muscles, and sometimes you can appreciate pap muscles from this subcostal view, and you can see some of the chordae from the pap muscles up to the mitral valve. Other features that are important to appreciate are obviously the heart valves. So let's go back to our slides again and start looking at the tricuspid valve, at the leaflets and the tricuspid valve chordae. So the tricuspid valve tends to be a little bit tricky to see, and what I mean by that is, depending on the way you're cutting an image, will all depend which leaflets, which of the three tricuspid leaflets you get. So, as you remember, there are anterior, septal, and posterior leaflets, and it's a little bit uncertain what leaflets we might be seeing there. What can oftentimes one can be almost very certain about is that in an apical four-chamber view, this particular leaflet here, right next to the septum, is more often than not the septal leaflet of the tricuspid valve. Obviously, in this view here down the bottom, that's a little bit more focused on the tricuspid valve. We see it there. And of course, you can see the tricuspid valve leaflets in that bottom view there too. Let's have a look at the pulmonary valve. Again, you're just starting out, and we don't want to sort of be going too far ahead of ourselves, but what we can see in this parasternal short axis view is the pulmonary valve, right ventricular outflow tract, pulmonary valve, main pulmonary arteries, and branch pulmonary arteries. We can certainly appreciate from this particular view, and you can image the pulmonary artery from others, we can appreciate the motion of the pulmonary valve from that view. The other valves, the mitral valve, well, the mitral valve just so happens to be one of the valves that you can almost find it hard to get away from at times. You can see it in lots of different views. So in this particular view, and remembering that the mitral valve is a little bit unique in that it's the one valve with only two leaflets. We see the anterior and posterior leaflets in this particular parasternal long axis view. You can see very clearly some of the chordae there that are almost certainly connecting to that posterior papillary muscle there. You can see pap muscles there, but not the mitral valve. You can certainly see the mitral valve in this apical four-chamber view, where we see the anterior and posterior leaflets again. And we see the mitral valve leaflet in this bottom right, probably the anterior leaflet there too. One of the important components of the mitral valve, as you'll remember from the lecture, is the annulus. It's an important component of all the valves, but what I want to reinforce to you is the importance of the mitral valve annulus. And you can probably appreciate that there's an area of brightness just across here, and that does correspond to the mitral annulus. In fact, in certain diseases that annulus can become very calcified and become particularly clear, and mitral annular calcification is an important thing to identify. We can see the mitral valve from subcostal views too. And then lastly, the aortic valve. Let's have a look at that. Well, the aortic valve is one that you see particularly well from excuse me, parasternal views. You can certainly see the aortic valve here. We can see the right coronary cusp and the non-coronary cusp here. We can see all three cusps here, and importantly, we can see the annulus, and that's another important feature to appreciate. With certain diseases can be significant calcification of the aortic valve annulus and the leaflets in disease settings. It's important too to be able to recognize the different cusps. So if we are looking from this parasternal short axis view, at the top of the image here, near the right ventricle, we see the right coronary cusp. Down here in this sort of bottom third here, what we can see is the left coronary cusp. And over here, the right coronary cusp. Again, of course, these cusps are named according to the coronary artery just superior to them. So just superior to this cusp will be the coronary sinus that leads to the right coronary artery. I can just see someone asking there, asking something. Sure, can you please kindly show the exact LV posterior wall on the parasternal long axis view? Yes, I will in just a moment. I'll finish this off here while we're just talking about the aortic valve. So right coronary cusp of the aortic valve, above that, the right coronary artery, left coronary cusp, above it, the sinus that leads to the left coronary artery, non-coronary cusp. So there is a sinus above that, but it doesn't give rise to a coronary. This particular view here is the parasternal long axis view. We see the septum, we see the basal and mid septum. We see the posterior wall here of the left ventricle. We see the basal posterior wall and the mid posterior wall. So that's where you can see it here. If we go over here to the parasternal short axis view, we can break things down a little bit further, and without leaping too far ahead, what we can certainly see are the anterior, lateral, posterior, inferior and septal walls. Okay, so anterior, posterior, key ones here to remember here. This is lateral and this is more septal. I hope that answers that question. Let's just jump back here for a moment. I showed you the pulmonary artery earlier, the main pulmonary artery and its branches. Let me just show it to you again. Main pulmonary artery can be seen from the parasternal short axis view and its branches. You can see the aorta, and let me just show you that again, the sinuses of Valsalva, the sinotubular junction, the ascending aorta. Here the sinuses. Here's the sinotubular junction. If we could see up a little bit further, we'd see the ascending aorta. Remember, the ascending aorta is broken up into two parts, the sinuses and the tubular portions. And this is the sinotubular junction where those two portions come together. So here are the sinuses. The sinuses are just above these leaflets here as well. We can also see the descending aorta. And interestingly, what we can see in this particular view is down below the left atrium here, we can see the descending thoracic aorta there. That's important that you recognize that you can see it there. We can also use suprasternal views to show the arch of the aorta and its branches. We'll go into them a little bit in more detail later on. the brachiocephalic trunk, left common carotid, left subclavian. That's the arch of the aorta. What we can also see from this particular view is another one of the vessels leading to the heart that I want you to appreciate. This is a subcostal view, so this is a modified view from this one here, is the inferior vena cava. The superior vena cava is much more difficult to see on transthoracic echocardiography, so we won't see it here. The last thing I wanted just to help point out to you for this anatomy tutorial was that one of the features of the heart that's very obvious from multiple views is the pericardium, and perhaps one of the best views to see the pericardium from is the subcostal view. You can see this very distinctly bright bright echoes coming from the pericardium here, and you can see it adjacent to the lateral wall of the left ventricle here as well. You can see the pericardium from other views as well. You see it particularly clearly here, superior to the atria. You can see it down here at the apex of the heart. And of course, if we go up here to views typically that we start with, we see the pericardium here and the pericardium anterior there as well. So what I hope I was able to do there is help you to appreciate some of the specific anatomical structures that are seen on standard two-dimensional echocardiographic images. We have not yet done a complete overview of all of the anatomical features, but I think to start with, I hope that's helping you to appreciate some of the anatomy of the heart in views that you'll use. And remember also that it's important to use multiple views, both because you're slicing the heart with a two-dimensional ultrasound beam, and also so that you can be sure that all of the features are appreciated from multiple angles, taking that limitation of 2D imaging into view.